So, good evening, everyone. Today is the Facebook Live session coming from Optima Arthritis and Rheumatology Clinic. I'm Dr. Sharath, and today we'll be speaking about how COVID-19 has affected children and how it will probably affect children in the future as well, and what are the things that we can do to prevent that. And to help us educate our patients and to guide our patients, today we have with us eminent pediatrician from Columbia Asia Hospitals, Dr. Supraja Chandrasekar. She is a specialist pediatric intensivist and who's trained from UK. And she was my colleague or classmate in Bangalore as well when we were doing MBBS training in Bangalore Medical College. So welcome, Dr. Supraja.
Thank you so much, Sharath and Divya. Pleasure being here.
Also, we have with us Dr. Divya. Dr. Divyashree is a consultant psychiatrist. She's trained from NIMHANS as well as done an MRC psych from UK. And she is a consultant psychiatrist in Aster Hospital as well as in Optima Arthritis and Rheumatology Clinic. So she has also agreed to join us to help to speak about the psychological impact that the disease and the lockdown has been having on children and their parents. So thank you so much, Dr. Divya, for joining our Facebook Live discussion today.
Thank you. Welcome, Supraja.
So I thought we'll start off with, Dr. Supraja. So we have had 2 waves now. The second wave is also officially retreating. The government has already given out a statement saying that it is receding. So what has been your experience with respect to the first wave of the pandemic and the second wave of the pandemic? How have children been affected due to the coronavirus disease directly during the first wave and second wave? And have you noticed any differences?
Yeah, thank you, Sharath, for this question. Now, if we go back 1 year, it almost seems like 10 years back, but last year at around the same time, we were just seeing the emergence of the COVID amongst the public. Children were said to be rarely or hardly affected, and that was quite true. We hardly had a child who was tested positive, and most of them were completely asymptomatic or had minor, what we call upper respiratory tract symptoms, that is cold, cough, and fever. And according to the government of Karnataka rules, we had to admit everybody less than 10 years for 10 days in the hospital so that we curtail their spread. Now that era has gone. In the second wave, what we have seen is a lot more of these children have become positive. Many of them yet are asymptomatic, but a lot of them come with symptoms quite different from the first wave. First and foremost, they may not even have a fever. They may just have a cold, and parents are often willing to think that this is just like the cold they usually had, or it's a normal for the child to cough, and all of them have turned out to be COVID. Also, a lot of these children, majority of the children coming to my outpatients, actually had pain in the tummy, vomiting, and loose stools, either all of them put together or individually. Almost each and every child who had loose stools and vomiting, it was just for a day or two, turned out to be positive. And it's quite important that we test and come to know that it is positive, because we will discuss later why it is important to know if a child is positive. Apart from that, we've had children with the usual cold, cough, fever, as well as just tiredness. The adolescents, the above 10-year-olds, they were just coming with tiredness, I don't feel like eating, or some really vague symptom. So my message to parents were, if you have any symptom in a child, which is unusual, which is not expected for them to have, it's probably COVID.
So that's very interesting, Dr. Supraja. But one thing that parents do ask me as well is that, but my child occasionally does get a fever and a cough or a running nose. Why should I show the child to the doctor? Why can't we just give some home remedies? Why should we test for COVID? Why can't it be the normal cold? So what would you reply to those kind of queries?
I think that's a very valid question by a parent. I would get the question myself with regards to my children, that do we have to run to the doctor for every cold and cough or fever? But I guess it's part of our responsibility in a pandemic. Now, when we are in the middle of this raging pandemic, which is kind of there all over this world, we really need to know if our child has COVID or not, because they seem to be a little like COVID butterflies. They spread the virus around without us knowing at all. It's very, very silent. And unfortunately, the elderly people and the vulnerable people are more at risk. That is the point number one. So it is important to know to isolate the child and to make sure only one caregiver is with the child. Or if it's an adolescent, they will take care of themselves in a room as long as their basic needs are met. The second important thing is when we know that it is COVID positive, our level of monitoring the child at home, because 90 to 95% of these children actually just need good home care, nothing else. They don't even need medicines. They just need good monitoring. So when we know that it is positive, we know what to monitor for and what are the danger signs. If it was just a cold and cough and we didn't realize this is COVID, we may slip out on the monitoring, because about 5 to 10% of these children can develop moderate to severe illness, which we are seeing in the second wave. And lastly, there is something called as MISC, or multisystem inflammatory syndrome in children, which is a post-COVID syndrome, and this develops after COVID. So it's important that we know if our child has had COVID or not.
That will help us later on if the child develops any other problems. We will know later on if we have tested. So that's a very important message. Thank you for getting that out. And the other thing, I don't know whether you've noticed in your OPD, you can just enlighten us. But there's been a dramatic fall in normal, so-called normal fever and cough because of mask wearing and social distancing. In fact, many of my arthritis patients themselves used to develop H1N1, and I used to always badger them that, please get vaccinated against influenza, H1N1. But as per the available literature, at least, or as well the available science or research, at least, the number of people developing H1N1 pneumonia or swine flu pneumonia or influenza pneumonia has dropped drastically. So, would that be another thing that you would want to tell parents as well?
Yes, definitely. As we know, if we look back 2 years or 3 years, whether it's dengue, whether it's chickenpox or typhoid or all other illnesses, there's a dramatic drop. One is the most important reason being people are not together as much. That could be one of the reasons. And we don't know a lot about this virus, but it seems to have taken the complete limelight on the stage of illnesses, because it's certainly dominated. However, Sharath, I do want to make an important point. These illnesses have not gone. In fact, vaccine preventable illnesses are still coming in. So I still think it is very important for little babies to get vaccinated. Although we may think that these illnesses have come down, it's very important that we don't miss the regular vaccines. And that is what our Indian Academy of Pediatrics has always been saying. We need to maintain physical distancing. We need to maintain mask culture and hygiene, as well as proper sanitizations. However, we need to take the regular vaccines also, as far as all, and waiting for the COVID vaccine. Of course, H1N1 has come down a lot, but it's not gone completely. So it's better to take the influenza vaccine. Yeah.
I agree with you completely. So we will come more to vaccinations, both of COVID as well as non-COVID later on. In addition to that, so we discussed about how children presented during the first wave and how children are now presenting during the second wave. But if you are to see the vernacular media, then you will see that there are a lot of very scary graphics coming up, which seem to state that children are going to be very badly affected in the so-called third wave, which is going to come. And it's almost bordering on paranoia, and it's quite scary. So my question to you, Dr. Supraja, is does that reflect the truth? Is there really something that parents need to lose sleep over, that there is some humongous horrible third wave which is going to come and affect our children like anything? Is that the truth?
If it's a single word answer, definitely my answer would be no. Certainly not. The only paranoia we need to have is in maintaining the right culture to face this virus. We need two important things. We need the responsible COVID appropriate behavior, and we need to be scientific. That's the only way we can, mitigate and prevent the pandemic. If we are saying, are we going to have a third wave, which is more likely to affect the younger population? Possibly, because virologists, epidemiologists have all put their brains and their calculations and projections. Yes, possibly. Does that mean that the virulence or the severity of the illness in children is going to be much more? I do not think so. It may mean that many more children might get affected. So we need to be prepared for that. And I think starting from the government to various intellectual bodies like the Indian Academy of Pediatrics and to various organizations, we are getting geared up. When it comes to children, I think everybody wants to do things right. So I think fear is the last thing we should have. Responsible behavior is the first thing that we should all adapt.
Thank you so much for that reassuring thing. And here I wanted to point out that the government of Karnataka has instituted a task force of eminent people to gear up and to protect children going forward. And Dr. Supraja is part of that task force as well. So, we have to take her words very, very seriously and abide by them. So there has been a lot of talk about the Singapore variant, and there was almost a national incident where Arvind Kejriwal and the country of Singapore, their diplomats started almost having a Twitter war with each other. So the media also seems to be projecting that the Singapore variant is like some kind of horrible version of the virus, which really affects children. So is there some truth to that as well?
Well, I don't think so. There seems to be two parallel worlds. One is the reality world and one is the media world and what is projected. And I am one of the fortunate people who get to have quite a lot of work to do at home and at hospital where we don't get to watch the media. And I think that's the best way where we can, just stick to reality, stick to science. This is just the Indian variant itself, which was seen there, and few of the children got affected. Of course, there are a lot more children which are affected here as well. But let's look at the bigger picture, including what ICMR says. A lot of children have got affected. But if you look at the total percentage, it's still about 5 to 10% of the children getting affected, of which only 1 out of 10 children are possibly requiring hospitalization. The rest of the 9 out of 10 are well at home and doing perfectly fine.
So that's a very, very reassuring fact that you have stated, and I just wanted to double down and just restate that children getting affected does not mean that children getting seriously ill. Okay, so just because children are having a COVID test positive doesn't mean that they're seriously ill. As Dr. Supraja stated, that children can become COVID positive and still not be seriously ill. Very few children become seriously ill. So it's when you see headlines and TV, anchors talking about how the third wave is going to affect children, they are talking about how the third wave or how any wave of the pandemic is going to cause children to become COVID-19 positive, but they do not mean that children are going to become seriously ill. So the percentage of children becoming seriously ill is quite low, and that is something that we need to always remember. So, Dr. Supraja, there's a question from, before that, I want to point out that Dimple gives a shout out to you and she says, hello, Supraja. And there's a question by Kavya who asks, is there a chance of getting COVID twice in the same child?
Yes, actually, we have seen that. We have seen a very small proportion of people who have been young adults and maybe just 2 children who have been tested positive in the first wave as well as in the second wave. And the people who came into my care, in both the times, they were just mild disease, nothing beyond that. But yes, it's a possibility. So what it just tells us is that the COVID appropriate behavior for us is there to stay. We cannot just give it up at this stage.
Yeah, so that is a very important point that you made. Dr. Supraja, and I think that is something that everybody has to take home, that COVID appropriate behavior, which means that wearing masks, maintaining distance, avoiding crowds, especially indoor crowds. These are the things that you need to definitely take care of, rather than going into other rabbit holes, and we'll be discussing those other rabbit holes as well later on. So Bhavna asked that, and we were about to come to this, but I think we'll come to it quickly, so that because Bhavna is asking a particular question, she asked, what about how to keep children active, and because they're always indoor. So how do we manage to keep, how do we help children in that scenario?
Okay, so there's a disclaimer here. I'm the last person to be an expert in this because, first of all, I'm not at home. So it's very difficult to say what we do. I think we should learn from each other. I get a lot of ideas from my parents and from the kids. They are amazing, the things they come up with on how to be active. It's just that we need to stimulate them. We need to give them a purpose, and we need to entitle them that, their role in this pandemic is to keep themselves fit and active, and to see that everyone in the house is on the move. For example, in my home, I could talk about my elder daughter, Anushka. So she loves to listen to music, and she's in the 10th standard, so she has very little time. But so what we've told her is, fine, you can listen to whatever music you want, but you need to walk. So she needs to do a 5-kilometer walk every day, and that's her time. We don't trouble her. We just give her the phone. And so that's, we have to get ideas from the kids, which are, which make them excited. Like, for example, doing 100 skips a day. Who can break that challenge? Or Zumba dancing, or, you can talk with your friend on the phone, chatting, but it should be while walking, and you have to sweat every day. So have these little targets and competitions at home, which make it fun, which make it exciting, and it has to be part of the game. Because sitting like this in front of the Zoom cam is just not going to help.
Thank you, Dr. Supraja. So I think that Dr. Supraja has very nicely managed to answer Bhavna's question. So I'd like to ask Dr. Divya as well, because just staying indoors has a lot of psychological impact on children as well. So how do we prevent that? Is there something that we need to take care of, and what do we do?
Yes, thank you for the question, Dr. Sharath. Actually, after the first wave, we did see that a lot of children did come in with a lot of behavioral problems because of either depression, anxiety, just loss of routine, which is stressful for children. They used to go out, go to school, come back, go out to play, come back, do their homework. All of this gone, suddenly. So this lack of structure itself is very stressful and can cause a lot of psychological problems in children. Like how Dr. Supraja was saying, involve them in activities. It's very important to have a structure, a routine in the day, in the limits of the indoor settings, whatever routine is possible. It's important because it takes away the unpredictability aspect from the child. So both the parents and the child can sit together and chalk out a routine to which they have to stick. It's called activity scheduling. So you start with, just like how when you used to go to school, start, wake up at this time, do this, and then, do a little bit of studies, and then maybe read a book, and then you get some time to play with your brother. Watch some TV, but, there's a limited TV time, and then come back, maybe help out at home, with the washing of vessels. So one brother will wash the vessel, the other sibling will sweep the floor. And once they do that, they get some, stars, which they can encash for maybe more TV time, or some chocolates or something like that. So basically, it's very important that we give the child a schedule to stick to, which includes everything: fun activities, activities that they don't like, physical activities, some social time. we try to avoid, screen time, but, we let them sit in front of the TV. Why don't we make use of screen time? For example, arrange a Zoom meeting between friends, or, they can play with other children on Zoom, like dumb charades and things like that. So we can adapt a lot of, and, maintain the routine as much as possible. But it includes a lot of creativity and involving the child as well.
Yeah.
Yeah, that's extremely important.
Okay, thank you. I think you gave a lot of useful points. Dr. Supraja, you want to add
I
something?
think Divya's point is just spot on. The point about maintaining the routine, it's so important, not just for their mental health. I mean, I know the number of children who are having um, problems related to their tummy in terms of either digestion, constipation, erratic lifestyle is the main cause, because they don't have the routine of getting up early, having their breakfast on time, and then starting the day. Most breakfast happens at 11:30 in the morning, so they've already gone 12 hours of fasting. They come with symptoms of gastritis, they come with all sorts of problems, constipation. It's just because they have lost their routine. I think, Divya, your point is excellent. I think we all should stick to the school. Is one beautiful thing which brought in that routine, because the school starts, they had to get up early, they had to finish their tiffin and then go.
Another thing is, I wanted to add here, avoid screen and food. Don't mix both of them together, because once they're in front of the TV and they're eating, they don't know what they're eating, they don't know how much they eat. So I think there should be screen-free times and screen-free zones. So dinner and bed, you don't use the screen. Um, if possible, all the family members sit together and eat. If not, at least the child uses the table and is not in front of either the gadget or anything. That's also extremely important, to add to Supraja's point.
Very true. I call that YouTube feeding in the preschoolers. We have a lot of parents doing the YouTube feeding, and that results in a lot of behavioral problems, abnormal attitude towards their food. So food becomes just like a time pass thing. It's actually a developmental milestone. How you eat, your relationship with food is something very important, because it develops in the younger age. So we can't get YouTube in between. I hope they don't sue me for this, but anyway, we can't get the screen in between that. We need to talk to the child. We need to eat with the child. That is where the age-old grandmother telling the Mahabharata, Ramayana, and giving, the little muddas to the child is priceless. If we can go back to sort of that culture, or telling them Goldilocks and Three Bears stories and feeding the child, that brings a lot of imagination and interest, but not passive watching the screen.
In fact, when Dr. Divya was mentioning about putting up a schedule, there's a video on our YouTube page about how to maintain mental health during the lockdown, which was made with Dr. Divya's help during the first lockdown. And in that, she mentioned several. It's predominantly for adults, but I think she had mentioned that you need to maintain a regular schedule as well, and that is an important point. I recommend everybody that you can go and watch that video as well. So Vinay makes a very important point. He asks, what about toddlers and small children? Are there any behavioral changes in them that occur due to the lockdown? Meaning children were really not very interested in maybe videos or screens, but because of the lockdown or because of COVID, have you noticed any changes in them? So Dr. Divya, would you want to mention anything about them, and then Dr. Supraja can add?
Yeah, so just yesterday, me and Dr. Supraja were discussing, she called them COVID babies. Babies were born during this time, during the pandemic. So once a child is born, once it comes into the real world, there's a lot of things that is going on in the brain. The child learns from every sense, right? Seeing, smelling, touching, hearing. So this social isolation, us staying indoors has actually taken away a lot of this stimulation. People are not coming, visiting, children are not able to go out. And also one more thing is this mask on the face. Also is preventing the child from learning facial expressions. So development of the social brain, as what we call it, is probably taking a backseat. The child might not be getting enough stimulation, which is very, very, very important for the brain to grow. So I understand the limitations and the apprehensions that parents might have, with respect to COVID. But I think sometimes we can still stimulate the child. We can still provide some kind of stimulation with keeping in mind all the COVID protocols. For example, you can take the child out for a walk. You can wear a mask, maintain the social distance, so that the child can see the outer world, see colors, see the flowers, trees, feel the wind. All these are extremely important. Might not seem so otherwise, but for a growing brain, it's very, very important. um, Whatever we are not able to, whatever we're depriving them of, I think we need to overcompensate at home. So there must be someone who's constantly engaging with the child, talking, singing, telling stories. Another thing Dr. Supraja was saying was, maybe we can call the children in the neighborhood. They can play at a distance, the child can watch. These are some things that we can do. It's extremely important. We don't have to show them the screen. We can actually expose them to the real world from a distance, so that they do get their stimulation.
So Dr. Dimple, sorry. So Dr. Supraja Dimple, who previously said hi to you, she actually asked this pertinent question. She asked that, can kids go down to play, or can they go down for a walk? And also there have been questions by Asha and Karthik who have asked, with respect to mask wearing in children, is there any concerns, especially in small children? So what would your answer be with respect to that? Like Dr. Divya mentioned that you can take the child down. Is that something that can be done safely? Would you also recommend that? And what are your views, or what are your recommendations with respect to mask wearing?
Okay, I think this is a very important point. With regards to children going outdoors, I call that vitamin N. That is the nature vitamin. It's one of the most priced vitamins. And I think compared to all the other zinc and the truckloads of vitamins that we are giving our children, they are all currently vitamin N deficient. So we need to replenish that. It's very important that they go out, they have direct first-hand contact with nature. Otherwise, their development goes in a different trajectory. We ourselves behave differently when we are not exposed to adequate sunlight, air, and just that feeling to ventilate in just on the face of Mother Earth. So it's very, very important. Now, how do we do that in a safe manner? So we need to understand, again, what is COVID appropriate behavior. We understand that it is the humans interaction, it is touching, it is the face and this area which is most important. So for example, in hospitals like in Columbia and Yeshwanthpur, we are always taught that if we want to eat lunch, compared to eating it in a closed room, they encourage us to go outside, eat it in the open. Ventilation is extremely important in moving away the virus and everything else. So when we are in an outdoor environment, it is fine as long as we are more than 2 meter distance from other people. There's enough space for everyone. We don't have to huddle. We don't have to crowd. We just have to be with a child. So one caregiver with a child, take them out for cycling, take them for a walk. It is extremely important. That doesn't mean, okay, we are all meeting at 6 o'clock, let's come down. No, that is not what I mean.
Understood. So basically, this is also something that I keep telling my patients. I think they've got, many of them have got the wrong message. So you cannot get COVID from going outside. You can get COVID only if you go outside and meet other people at close range in a unventilated scenario and without masks. So those are COVID inappropriate behavior. So going outside while wearing mask, while maintaining distance, especially in an outdoor environment, is absolutely safe. So you will not catch COVID from going outside. So taking your child for a walk, taking your child for cycling is absolutely safe. And thank you, Dr. Supraja, for clarifying that. And I hope that has answered Dimple's question.
Just a minute about
with respect
mask.
Yeah, with respect to the masks, which Asha and Karthik asked about.
Yeah. So if you look at the WHO guidelines, they say the preschoolers, that is, let's say less than 3 years, it is inappropriate for us to give them a mask. However, I have these brilliant 18-month-olds, even 1-year-old, who come with the most fitting masks so well. And if I try to remove them, they get so offended. So whereas the adults will be like, with the most loose mask with their nose popping out, whereas the kids are so brilliant. So that's because they follow things so well. But it's not a great idea to give the little ones, especially less than 2 years, a mask. Both the CDC and the WHO have said that. What is important for them is to actually shield them. See, here we are not trying to prevent a virus entry. We are trying to prevent the droplets which are coming, which are quite big bubbles. It's like, so to prevent that from directly touching our face when we talk and we're excited and when we cough and sneeze. So it's better to have some sort of shield. So it's okay to wear a face shield when we are going to a risky environment, which anyway during the lockdown we are not going to do, or even post-lockdown we may not. But there are instances where we need to take babies for vaccination. We need to go to the hospital. We need to show our children to the doctor for whatever reason. And if we need to protect them, the younger ones, it's better to wear a face shield. And just stay away from people, as Sharath said. Stay away from very closed, poorly ventilated places. But mask is generally meant for above 3 years.
Yeah, so that is, I hope that has answered Asha and Karthik's doubts. So small children masks, probably it's difficult to implement and probably not appropriate. And we need to use other things like face shield, as Dr. Supraja very nicely pointed out, and more importantly, maintaining distance and being cognizant or being aware about ventilation. So outdoor settings are definitely much safer than indoor settings. So those things help to clarify your anxiety, Asha and Karthik. So Dr. Supracha, you were speaking about vitamin N and nature and how it is very important to take children out. I think Sumana has asked the same question. Sumana, we have answered that question just now. It is safe to take your child cycling, but you need to continue to follow COVID appropriate behavior. That is, he needs to wear a mask because he's 10 years old, and he needs to maintain distance from other children and other adults when he's out cycling. So Dr. Supraja mentioned about vitamin N on nature. So there are many people like Girish and Chaitra. They're asking, what about zinc and vitamin C? So there has been a lot of lot of promotion or a lot of interest in so-called immunity boosting methods. So what is your opinion about zinc and vitamin C, Dr. Supraja?
Okay. If we go to all our bodies and ask what's happening inside, the first thing they're going to say is, why are you giving us so much of zinc and vitamin C? All of us are guilty of it. A lot of vitamin C and zinc is being given to children and adults, and some of them say, from the last 1 year, we've been religiously taking. I said, who told you to take? Said, we've just taken it because everyone says it's important for the immunity. So first, let's understand. Really, the immunity is not a problem when it comes to COVID. We are all fit and immune as such. It is not an immunity-related disease. So I don't think we should be behind boosting the immunity through artificial means. And secondly, just vitamins and minerals, that is zinc is a mineral and iron is a mineral, and vitamins are not going to dramatically increase the immunity. If the solution was so simple, honestly, we wouldn't have had the pandemic. So it is not. Basically, we do things to improve what is called as innate immunity. There is a component of natural immunity and acquired immunity. Acquired is when you acquire it through vaccination or through disease process. Whereas natural immunity, like for example, the skin itself is a natural immunity. It is a barrier to prevent organisms from entering. Like that, the nose, the mouth, they're all natural barriers. Similarly, we have blood cells in the body which work as a natural immunity. Now, to strengthen the natural immunity, you need a whole lot of things which is called as health. And this health has various aspects to it. It has a mental component, it has a physical component, and both of them have to be perfectly sound to get a good immunity. So immunity is not as simple as you take a pill and the immunity develops. I call it eat, play, connect for children. If children have the right behavior to eat, to play, and to connect, which is basically with themselves, with Mother Nature, and with their family well, then their immunity is perfect. So we need to have all these three domains. They need to eat healthy, they need to play well, be physically active, less screen time, and they need to maintain their connect with themselves in terms of meditation, good adequate sleep, less screen time, connecting with their family and friends, good social behavior, and that's how they be healthy and immune.
So we previously made we previously had a session about all of these so-called immune boosters, and in that, Dr. Bikram, who is a eminent clinical immunologist, he told very nicely about how you can take care of your immune system. So, immune system is a very complex, varied system which has a lot of working parts. Okay, so just like your mobile, some mobiles the screen is good, some mobiles the RAM is good, some mobiles work quickly, some mobiles are good for gaming, some mobiles the back camera is good, some mobiles the front camera is good. So you can't say what can I give to my mobile to make it stronger, right? So it has a lot of different parts. So similar to that, the immune system has a lot of different parts, and all of these kind of simplistic ways of so-called boosting the immune system are all pseudoscience. So thank you, Dr. Supraja, for pointing that out. And if anybody else is interested about how to help your immune system, you cannot boost your immune system in any way. You can help your immune system. So then you can go back and see that video by Dr. Vikram Jain. It's there on our Facebook page. In addition to that, there are many questions regarding vaccination, but Vinay asks about the immune system in children and whether it is weaker or stronger, and he's having a lot of queries with respect to that. So that I think I will answer that the immune system in children is definitely different from the immune system in adults. In one way, you can say that the children are more prone to certain illnesses, but I don't like these terms of stronger and weaker. So as I said, the immune system has a lot of working parts, and some parts are different or work differently in children, and some parts work differently in adults, and some parts work differently in elderly. If you're asking specifically about COVID, then I think that Vinay, your question has been answered by Dr. Supraja, who said that though children might develop the infection, they tend not to have any severe illness, or they tend not to become extremely ill. So Rakesh Gowda is asking that many times it becomes very difficult to implement many of the suggestions that Dr. Supraja and Dr. Divya gave. That children tend to have behavioral issues, especially oppositional issues, where they do the opposite of what we tell them. So how do we prevent that, and how do we guide children in this kind of scenario? What is the advice that you would give parents, Dr. Divya?
Yeah, so good question. Definitely, it's not as easy. So when we say oppositional behavior, mean you say something and the child is defiant, doesn't want to follow it, or does the opposite. So then we need to analyze why this is so. Most of the time, it is because of lack of stimulation. In the sense, the child does not get enough attention that he or she feels that they need. Two, we always tend to point out negative things and always try to, we are always ready to scold or say, criticize, but we are not as appreciative. So one thing that we usually tell parents is to mix both of them, positive feedback and criticism or negative feedback. So what we can do is, when we need a child to agree to what they say, we need to get their attention. So if you are able to at least pick up some good behaviors and positively reinforce that, then the child will definitely will listen to your criticism or your suggestions. Also make sure that your criticism is not very cruel or very strongly worded. You can start with suggestions, and you can also reward it. If you do this, you will get this, and you have to stick to those rules. You can't bend it. You can't, if the child later throws a tantrum, okay, take it. You can't do that, right? So make some rules, stick to it no matter what. Children will follow rules much more properly than adults. And make sure that you spend enough quality time and you positively enforce some behavior. Because once a child has taken the label that, okay, I'm a troublesome child or I'm a difficult kid, then it's easy for him or her to break rules, and it's they don't care because they've already formed that opinion. Parents have already given them that label. So it's important that we make sure that we don't let them develop the labels in their mind, or we don't give them those labels. So it's important for parents to sit down and discuss about, after the child has thrown a tantrum, or if child has done an oppositional thing, sit down and talk about why did you do this, and what we say ABC. What is the antecedent, what made you do it, and what was the behavior that you did, and C, consequence, and what happened eventually, what did you get out of it, how do we prevent this from going forward. It's a little difficult, but once the child has gotten the flow of it, it's easier to take care of your children. But it mostly depends on how we interact and how we discipline, and the kind of instructions that we give, and how we reinforce behavior. But many times, maybe we can come to it later, irritability and defiant behavior can be a sign of developing depressive or anxiety related issue. Maybe we can talk about it a little later. But if you are asking me in general, having a routine, having a kind of reinforcement like a star chart, if you do this, you will get this many stars, and if you get this many stars, you can get some TV time. If you haven't got this many stars, then you don't get TV time, right? So this kind of technique will is extremely important and is helpful in disciplining children.
So, and the other thing that I wanted to ask you or point out is that because the lockdown is stressful for parents as well. So many times, despite these very useful tips that you have given, many parents might feel overwhelmed. So in those kind of scenarios, is it worthwhile to take a consultation with a psychiatrist or a clinical psychologist at that point? Would you recommend that?
Yes, there are some. Let us come to the signs and symptoms of possible, mental health problems. If you see a pervasive means lasting for days throughout the day, irritability, a change in behavior. The child was active, has stopped being active. I was very interested in talking to friends, stopped being interested in talking to friends. Irritable, crying most of the time. Some children are very clingy, doesn't want to let go of the mother, although he or she was independent and used to do things normally before. So there are a lot of these kind of behavioral changes. Usually children and adolescents show their stress, if it has affected them very badly, in terms of behavioral changes. Not like adults. We tend to cry, we tend to talk to people, or we tend to say, convey that we are depressed, but children are not able to do that. So if you see pervasive changes in their sleeping patterns, changes in their eating patterns, in their activities, being irritable, then it is important that, then it means that probably they have developed some kind of mental health problems. There is no shame. There is nothing to worry about. This is something which can be reversed. We know that world over, on everyone, this pandemic has, really challenged our coping skills. It's become such a big stress. I don't think anybody is, capable of dealing with this stress. So it is only, logical that, some people will crack, will have some problems. So that problem, if it is remedied immediately, most of the time children just need to be spoken to. So if the parents are not able to do it, then they can, get professional help. Sometimes if there is someone in the family who is able to talk to them, then they can really sit down and talk to them. Many times it's a lot of thoughts that are going inside the child's head we don't know about. um, Sometimes they might have read something in the news, or they might have seen something, or they might have heard their parents discuss, which has caused. So just talking to them openly, asking them what is going on in their mind is extremely helpful. Even if maybe the parents are not able to do it, somebody in the family, grandparents or cousins or someone can do. And if nobody is able to do it, then maybe professional help is advised.
Thank you, Dr. Divya. That was very helpful. Yeah, please add in, Dr.
Thank you, Divya. Those were very important points, and I think very sensitive issues that we all have to deal with. Coming on to the question of, which one of the parents had raised, that if we are not able to handle the situation at home, what do? We can't follow those rules. The child is not listening, and they are getting stressed. And as Divya said, it's taken a toll on everybody. All of us have broken down at some point, and it has made us go completely cracked up. So I would suggest definitely seek help. Even if it's not a psychiatrist or a clinical psychologist, just talk to the pediatrician. Sometimes it makes a huge difference. I want to talk to my colleague and say, look, I'm struggling with my children. I don't know what I'm doing wrong, but this is what is happening. And them speaking to them makes a big difference. It does make a difference. So when I speak to my children, as in the children who come to my OPD, and we interact, we have a beautiful chemistry of our own. And the children seem to listen to me, whereas poor things, their parents are struggling, just the way I struggle with my children. And then it's as simple as they get into a hobby like drawing. Now, this is the latest thing, Sharath, which I'd like to share. Most of the quarantine children, I have got them into a habit of giving a picture. So in 10 days, I get so many pictures from children. It's amazing how they use their creativity. And each time it gets better and better. Children who never used to paint or draw have started doing that. So it's completely taking their focus away from the horrible isolation, quarantine, looking at disease and warning signs, to doing something beautiful. So I love my WhatsApp now. It's full of all these pictures that I've collected. Yeah. So I think help and alternate hobby is very important.
That's a very nice, inspiring story. So there are many questions coming in, and Anita, Mohammed, Santosh, as well as other people, we will be answering your questions one by one. But right now, Dr. Divya spoke very well, and Dr. Supraja also added on to that of how to take care of our children's mental health. Again, we come back to questions with respect to physical health. So there is one point that I remember Dr. Supraja saying that I want to get it across during this Facebook Live, and Deepak has asked that question. So he asked, what about giving children hot water or steam inhalation? So what is, Dr. Supraja, please answer that question.
Okay. So there are a lot of home remedies that we do, which is followed by customs, tradition, beliefs, etc. One of them is steam inhalation. And I think there is some sort of scant evidence in adults on using steam inhalation. Now, just because it possibly may work for them does not mean it works for children. It is plain, simple, dangerous. It is most disheartening to come to the emergency and to see a child completely having burns and scalds. And trust me, this is something we see on and on again. And it's very, very sad, because it's either the parent taking the steam inhalation with the child on their arm, and the child almost always pulls that across. So the front of the body is completely scalded. Recently, we had a beautiful 11-month-old baby who had severe scalds, unfortunately COVID as well, and had to be admitted for so long. And the family went through a most traumatic time. The guilt of having had to have their child go through this. So steam inhalation does not have any evidence in children. Please do not do that. We can have other simple measures of putting saline drops in their nose and just leaving them alone. They can deal with their cold very well. They can deal with COVID virus far better than us.
So thank you, Dr. Supraja, for pointing that out. So Girish asks, with respect to treatment of COVID in children, we will not be dealing with that with respect to this Facebook live session. But suffice to say that, as Dr. Supraja said a few minutes earlier, majority of the children do not have serious illness. So it's very important to stay in touch with your pediatrician so that they can monitor your child. But it's not something that you really need to panic about per se. And Sandeep and Manjunath also, you can just go back and see the video that will be there on the Facebook Live. They're talking about mild cough and cold. But as Dr. Supraja said, any kind of symptoms, even if it was normal to the child previously, do not assume that it is normal during the pandemic, especially during the waves. Do not assume that it is normal or related to something else or related to the weather or stress or anything like that. Trust your pediatrician and get testing done, because testing is important. It helps the pediatrician to guide treatment and also to monitor the child and also to decide treatment with respect to something else called MISC, which we'll come to later. So both Sanju and Rashmi are asking about obesity. So many children have developed obesity. How do we deal with that? So Dr. Supraja.
Yeah, Sharath, just one point about the treatment. I think it's a great opportunity for us to just give 5 seconds to treatment. The treatment in children with COVID is basically only symptomatic, just the way we treat any other viral infections. No antibiotics, no azithromycin. So please do not take antibiotics at home, just over-the-counter prescriptions and asking the pharmacist and taking. No, this is not acceptable. It is not good for the child. And various cocktail of medicines are there, like favipiravir, doxycycline, ivermectin. None of them have evidence in less than 18 years. So basically, they should not be used. There is a very, very small percentage of children who require specific drugs. These are only used in the ICU. So thankfully, it is only the ICU people who would do that. From our point of view, at home, no medications for COVID. So that's one point that I wanted to make.
So I think that answers Girish's question. So before we go on to the next question, I got reminded of a common WhatsApp joke which is roaming around, where somebody is asking that my uncle in Bangalore is saying to start off on this antibiotic, whereas my auntie in some other place is asking me to start off on this medicine. And the other person asks, but what did the doctor advise? And the person replies, do we really need to meet a doctor? So you do need to meet a doctor, and you do need to follow the advice of your pediatrician. Most important than anything else is what the pediatrician monitors in your child, what the pediatrician sees, how your child progresses. That is more important than any other particular medication. So there are a lot of questions with respect to vaccines, and we'll come to that later on. But Dr. Supraja was asking about any advice with respect to Sanju and Rashmi, who are asking about the problem of obesity in their children.
Yeah. So obesity, I would look at it as a syndrome. It is not just related to what you eat. It is a complete lifestyle associated issue. It is related to the family dynamics. A whole lot of issues are related. And I think all of us have the guilt of putting in far more kilos this year as compared to all other years. Most importantly, sorry about that. Most importantly, we need to remember that it's what the child eats, how the child plays, and how the child connects, which will determine their health. And obesity is just deviation from the health status. It is malnutrition in a way. So coming quick point about how they eat. They should eat with 5 things on their plate at any point, whether it's breakfast, lunch, ordering from Swiggy, it should have 5 things. What are the 5 things? Half their plate should be fruits and vegetables. I repeat, half their plate should be fruits and vegetables in any form. Extremely difficult target, but that is what we need to prevent all those extra kilos and to prevent our children being overfed but undernourished. Next, apart from half the plate fruit and vegetables, quarter of the plate should be grains. That means the rice element is only quarter. The other quarter should be pulses, which is the protein. It could be your dal, the sambar, the saru which we use. It should have a lot of protein, and it should be equal quantity to the amount of rice. And the 5th element is dairy, which is mainly curds, home-based curds. So if we eat in this proportions, our children are going to stay healthy. They're going to get all their mix of vitamins. They don't have to take it from outside. So this is from the diet point of view, and completely cut back on anything which is processed. Anything which comes in a packet is processed, whether it's the noodles, the biscuits, the chips. However they promote health, it's false. If it comes in a packet, it is not healthy. It has to be natural foods. Next is what they do in terms of their activity. So compulsory less than 5-year-olds, they need 2 hours of activity at least. And the older children, minimum activity is 1 hour completely, where they make which makes them sweat. So somehow we need to get that. We need to cut back on the screen time. And lastly, it is adequate sleep. So the preschoolers have to sleep for about 11 to 12 hours, whereas the school-going age group has to sleep about 9 hours, and adolescents have to sleep at least 8 hours. So if we remember these basic points with connection with vitamin N, I think we should be able to deal with the obesity.
And for the people who are joining in late, vitamin N is nature. So you do need to take your child out while maintaining COVID appropriate behavior. That is wearing masks and maintaining safe distance. One important thing that I wanted to point out here is that you cannot impose these dietary restrictions and physical activities on your child alone while the rest of the family. As Dr. Supraja pointed out, obesity is a problem which the whole family has to tackle together. So if the child follows proper diet, it means that the adults and the other children also have to follow the same diet, irrespective of whether they have problems with obesity or not. You cannot expect the child to be on a diet whereas you are munching away on, packaged things by the side. So there's a very pertinent question which Pawan has asked. He is told that suppose I or an adult in the family has COVID and they are supposed to be in isolation. How do they perform the household chores, or how do they go about doing things without infecting the children? So what would you suggest with respect to this, Dr. Supraja?
Yeah, I think the second wave really brought out a lot of these problems, especially in nuclear families. So let's remember one thing. If there are only 4 members in the family, that is 2 children and 2 adults, and 1 adult is positive, then the other adult, be it the father, whoever it may be, takes over managing the others. It's not just the mother who's supposed to cook with the mask and with the COVID. I hope that point is very clear. And secondly, if the child is positive, if it's a above 10-year-old or a 12-year-old, they are very responsible. They will be in their room. We need to be talking to them. They need to have some sort of video conferencing or a way in which they can talk over the balcony. But they can be in the same household. But if it is both the parents being positive, then it is a tricky situation. The children stay at home. We need to contain the infection. The children should not be packed off to their grandparents' house. This is a disaster, because that is how bunches of families are getting positive, because they actually get the virus and then very imminently spread it to the next family member because they are worried about the child. In most probability, the child is already positive and they are asymptomatic. They have no idea about it. A very interesting study is coming out where we are doing the antibody levels of children, and it is surprising how many of them are antibody positive. That means they've already got the illness, disease, and it's gone without even being aware of it. So most of our children are already positive and we don't know about it. So in the house, when somebody becomes positive, please keep the children at home. Now, to reduce the exposure to them, of course, we need to maintain with distance and with masking, but the rest of the activities can be done. It'll be best to not share the bathroom. But if there is only a single bathroom, we deal with it. The children cope up with it well. I think a one-on-one interaction with a pediatrician will come up with innovative solution which is packaged for that family. It's each family has different dynamics which we need to respect.
Also, masking at home, isn't it? Wear the mask even inside house, inside home.
Yes. So what we say is during sleep, it becomes difficult to wear. So we wait for the child to sleep and then go a lot distance, keep the room well ventilated, and then remove the mask and sleep.
So there was some time back, there was very nice research which was done in Germany, and after that we understood that just because somebody in the house has developed COVID does not mean that everybody in the house is going to develop COVID. Simple precautions which everybody has been stressing on from the beginning, if followed diligently. Diligently means throughout, without even a small break. If you follow that regularly, you will be able to protect other household members. So that is mask wearing, washing your hands regularly, and most importantly is maintaining a safe distance and being aware about ventilation. So make sure that there is a lot of ventilation in your house. If you're taking off the mask for eating or something like that, make sure that you're in a separate room. So these are the important precautions that you need to follow. And as long as you follow these precautions, you can definitely make sure that other people in the household will not get affected. In addition to that, of course, as Dr. Supraja said, we really don't need to be so panicky. She said that in the beginning of the current Facebook Live session as well. She said that most of the children, and she said it just now as well, where she said that a study which is called serosurveillance has shown that many children have developed the infection and we have not even realized it. So most children will not have seriously extreme illness or anything of that sort. So don't panic and follow the general precautions. There has been there are a lot of other questions also which are coming in, but I think we are running out of time. So we will go to MISC. Vasundhara is asking about MISC. So can you just tell us what is MISC? Why do we need to worry about it? And later on, you can answer Vasundhara's specific question. She's asking, is there any diet which will help to recover from MISC?
Okay, thank you. So MISC is basically the WHO term for multi-system inflammatory syndrome in children. To put it in simple words, it is a post-COVID syndrome, post as in after COVID. So children who get COVID, as Sharath mentioned, which is completely asymptomatic, neither the child nor the parent nor the pediatrician knows that the child ever had COVID. It is only incidentally detected later when they find antibodies in them. How can they get antibodies without being vaccinated? That means they've actually had a natural infection. Now, what happens in these children is 2 to 4 weeks after the infection has come to them, they are a unique population in which a very small percentage of them, let's say 2 or 3 out of 100 children, develop this condition of MISC. Now, MISC can range from being mild to some of them, yes, being severe, requiring even ICU treatment. So the important aspect is to recognize it. Now, how does it present? It primarily presents with fever. So fever is a common thing in MISC. In like largely 90 to 99% of children have fever, and it's part of the definition. Now, once there is fever, you also have other things like their skin changes. It can be rashes on the body, swelling over the face, swelling on the arms, red lips, red eyes. This could be the skin and mucocutaneous changes, as we call it. Thirdly, there could be affecting any other organ in them. For example, in their chest, they could be having fast breathing, coughing, or it can affect their heart where they have cold hands and feet. They become very lethargic and dull. They don't feed. They become very irritable. Or it can affect their brain where children may actually develop fits or they become very drowsy, etc. So most of these symptoms are worrisome. But the problem is we tend to say, oh, this may be dengue or it may be typhoid fever. Let us try this antibiotic. Let us see. Let us take a video consultation and wait on it. No. If you have an idea that the child has had COVID before, and there is a fever, especially high-grade fever, it's very important that you show your doctor. Possibly physical examination would help in this situation, or definitely consult them formally on a video consultation so that we can pick up what are the danger signs and diagnose this MISC early. Now, what do we do after diagnosis? There is specific treatment. And this year, we are proud to say that we have strict protocols. We know what is happening. There is enough evidence. Last year, there was a lot of confusion. We were learning from the New York experience or UK experience. Sharath is on the helm of the affairs because he's an immunologist and he guides our treatment processes at Columbia, Asia. And it's brilliant working with him. But this year, don't you agree with me, Sharath? We are so clear in what we need to do. As long as the child has presented to us, we know what to do next. And it is very much curable. It's something new, but we all now are aware of it.
So Prakash, I think, is joining late and he's regretting that he's joined late. Nothing to worry about, Prakash. The recording will be available on the Facebook page and you can see it at any point. Pratik is asking about developmental deficits in toddlers. Pratik, we already discussed that in the early part of the video. So please do come back and look at the video. Dr. Supraja as well as Dr. Divya has specifically answered the question that you are asking for. So there are a lot of questions with respect to Anita, Vinay and Deepika especially are asking about the so-called hype with respect to the black fungus and whether they really need to be concerned with respect to children about this black fungus, white fungus and yellow fungus. So Dr. Supraja, your thoughts on this issue and your experience with
I was just wishing this whole session ends before the fungus dialogue comes in. Well, this is something I don't like because we don't know much about it. All these fungi have been there, just like how mushrooms have been there. They've been there years together, and they have been affecting a lot of the adult population from before. And there are multiple reasons beyond COVID which affects them. But let us look at simple things, what we can do to prevent these fungal infections, which are more so opportunistic. That means these kind of fungi are there everywhere in the environment. That doesn't mean we all will get it. We won't get it from touching the mucor or the black fungus. We will get it when our immunity is compromised. So when does our immunity get compromised? When we have bad hygiene, like reusing N95 masks that should never be reused, wearing wet masks, having a soggy environment. Secondly, blood sugar being not well controlled, which is usually not the case in children, but in case in adults, can definitely affect immunity and the defenses of the body. Thirdly, inappropriate use of certain vitamins and minerals. There is a theory that it can contribute. Fourthly, COVID itself being an infection that overwhelms the immune system, sometimes the severe COVID may be a risk factor. And there is multiple things which are coming in as research. Still, we can't pinpoint our finger as to what it is. Thankfully, so far, it has not been a major player in children. Yes, there is some association with the steroid use and this, but steroids have been used for various conditions. The bottom line is when we use a medication for the right indication, we are justified in using it and it helps. But when we just take over the counter medicines because WhatsApp University has told us and so neighbor has told us, we get into a lot of black and white problems.
So there's a very important point that you made that I want to highlight, that especially to recognize MISC and to be able to determine what is the exact situation of the child, how to protect the child and how to monitor the child, it is very important that patients and parents do an official consultation rather than just calling up over the audio or making an audio call or just WhatsApping the doctor or messaging the doctor that, just tell me what tablet to give or tell me what syrup to give. So that is not an appropriate way to go about it. To help the doctor, to help your child, you need to do an official consultation. There are, even the government is providing free video consultation as well. So that I'm not aware about how to access that, but probably we can put that up on our Facebook page. But it is important to take an official consultation is what I wanted to highlight. Since we have already short over time, but I missed out one question by Sandy Sidhu, who asked about his child with systemic GIA and what are the precautions that he needs to take. To Sandy, it is the same precautions that we have been speaking throughout this video. There is no difference between children with rheumatological or other disorders compared to children who do not have these illnesses. The precautions that you need to take are the same. That is, you need to make sure that if they're more than 3 to 4 years, as Dr. Supraja pointed out, then they can wear masks. But otherwise, everybody else in the family should wear masks so that the child is protected. Because if you catch an infection, you're more likely to give it to the child. And in addition to that, maintaining distance, that is what is important. And be aware about ventilation. Outdoor spaces are actually much safer than crowding in indoor spaces. So with that, I think we can go to the last part of our Facebook Live session, which is with relation to vaccines. Before we go on to COVID vaccination, which is, of course, a very hot topic in among the people attending as well as among the general media as well. I think Dr. Supraja alluded to this, but I would want to come back to this again and mention about forget COVID vaccination. What about the normal vaccination? So there is, in fact, I was coming across a surprising statistic a few days back where it showed that in certain communities, 74% of the children are lagging behind in their vaccination, in their normal vaccination. So doctors are now scared that forget COVID, now children are going to develop measles, that there's going to be a spike in measles cases. I mean, that is really, really horrible. So Dr. Supraja, what would you tell to parents who are scared to just get normal vaccination?
Yeah, I would like to say that what is the fear? The fear is coming to hospitals and getting the vaccination. I think this is unfounded, this is unscientific. If we follow COVID appropriate behavior, and if we discuss with the doctor as to when is the time, most hospitals have made beautiful mechanisms in which they can protect their children, get them in the lean times, get the vaccinations done. It is extremely essential to get the regular vaccinations done. However, yes, during booster vaccinations, let's say during the peak of lockdown when there is no transport, etc., it's understandable to postpone it to, let's say, June 7th when the lockdown ends. But otherwise, especially the primary vaccination in the little children less than 2 years old is quintessential. We need to get it done because the last thing we want is to have vaccine preventable illnesses in the fear of COVID, which in 90% of our children, 90 to 95% of our children is only going to be mild.
So, in fact, there's been a little bit of confusion with respect to certain vaccinations. Like during the first wave, it was about BCG and MMR, and currently there is a lot of interest that maybe flu vaccination is going to prevent COVID. That if you take BCG, MMR, or flu, it will prevent COVID. So, in fact, Sai Lakshmi Radhakrishna has asked that particular question. So what would you answer to that?
Okay, so flu vaccination does not prevent COVID. It prevents flu, which is a COVID-like illness. So we need to take flu vaccination. Yes, it is an IAP recommendation. And there was a little buzz because in the paper, the Maharashtra task force seemed to have suggested take flu vaccination. That was a misquote, and it came back from the IAP Maharashtra saying that they just recommended for children to take flu to prevent another contagious disease, which is almost similar severity in children as compared to COVID per se. So we do encourage children, especially in this COVID season, to take flu vaccination. At least for the first 5 years, it's a yearly vaccination. And in the first year, for the first time when we are taking it, it is 2 doses 1 month apart.
So now we come to the hot topic, which everybody is very interested about, but we specifically kept it towards the end for the most important reason is that you will get more benefit out of following right now what is in your hand. In your hand is COVID appropriate behavior. Like as long as, even if you do not vaccinate your child, if everybody in your home is following COVID appropriate behavior, the chances that and if everybody in your home is vaccinated, then unlikely that your child will catch the vaccination. Child will catch the infection. So it's as simple as that. So vaccination, though it is of interest, a lot of vaccination of children against COVID-19, though it is a lot of interest to a lot of people, it is not something that is really something which should receive that much priority. And that is why we kept it towards the end of the talk. So before going on to the most important topic, I would want to address one specific question by by Mr. Santosh, who asks that whether getting vaccinated before having children, will that cause any harm to the baby? So that I can answer that. The answer is no. In fact, right now, even pregnant women are being advised by their doctors to take the vaccination because pregnant women also, if you develop COVID, that is definitely, we have seen that it can cause a lot of problems. Until date, we have not found any issues with pregnant women receiving COVID vaccination. That is a decision that the individual obstetrician has to take at this point. It is not a general guideline. Please don't mistake my statement as a general guideline. But what I'm trying to emphasize is that it is being recommended by obstetricians for pregnant women. And the government of India has also said that even lactating mothers, meaning mothers who are feeding their children, can also take the vaccination. So it's not something that we really need to worry about. There's no concern medically of any effects of the vaccine that any lady takes on their children, either who are, children who are women who are currently pregnant, who are currently feeding, or who are going to become pregnant. So definitely nothing to worry about. I hope that has answered your question. So coming to the most important topic, which Anandita, Anita, Mohammed, Santosh, Rashmi, Karthik, all of them have asked, which is, will we get a COVID vaccination for children? How long will it take? And is it appropriate? So Dr. Supraja, your points on that.
Yes, we will get the vaccine. It's already there. Trials have started. See, we should remember one thing. In the pandemic or the epidemic, there has been a rapid escalation in giving the license to the vaccine. Now, before a vaccine license is given, we have to go through rigorous safety, because we have to see the long-term effects, especially so in children, because they have many more years to go. So we just can't take a chance, especially something which deals with the immune system. So now we have fairly good control over the vaccines which are available for adults. And since we are confident that we've vaccinated crores of people now, and they're all doing well, more than majority are doing very well, and it has made a tremendous impact on the severity of the illness. So with that background, we have started doing the trials in children, both abroad as well as in India. So it is going to take time. But as Sharath beautifully pointed out, we need to see what we have now. We are always seeming to think what someone else will do, when will that come? Speculation is something we all enjoy. I think we should come out of that. Now, have you all taken your vaccine? And if you've not, please ask yourselves why, and what is the next thing you are going to do to see that you have taken that vaccine. Now, since that is open to above 18 years, everybody should be vaccinated. It's difficult. The supply chain, the demand, everything is difficult, but we have had ample opportunities, and we need to use it.
So that is where you need to focus. Even if your main idea is to protect your children, focus on getting yourself vaccinated. Each one of you tell somebody else who's hesitant to get vaccinated, because the more the number of people get vaccinated, the more likely is that the COVID infection transmission and all will stop, and everybody will get protected. So there is a lot of hope when you see countries like Israel, England, US, where so many people have got vaccinated that now the COVID-19 has no place to spread at all. It's not even spreading from one place to another place. And now people have stopped wearing masks also in those countries. So those countries really give me hope that if all of us do our duty and go and get vaccinated, then definitely we will be able to get this under control. So I think we have run out of time, but we've had an excellent discussion. I would want Dr. Supraja, so I would want Dr. Supraja to end with one message, if you would want to highlight again, or a summary to everyone who has been attending this session.
Sure, we will do the summary, but one very important point about the vaccination: please don't sit and choose and debate, do I really need to take the Covaxin or the Covishield? Or it's not the perfume that you're going to wear. Just take the vaccine that you're going to get. This is life-saving. It makes a difference. Take it. What I answer my patients when they tell me, what you have is what you're going to take. We were given Covishield, we took it, full stop. And I'm grateful to God and thankful that I've got this protection, and the government helped us so much, being frontline workers, and we have been given the vaccine. Yes.
So if you're really concerned about taking another vaccine, then you can take it later on. I mean, all of these vaccines will become available in the private pharmacies later in the year. And at that time, suppose you have only Covishield available where you stay and you want to take Covaxin. So just take the Covishield, and probably later on, research is ongoing. And then later on, once Covaxin is available in the private, you will be able to buy it and take it. I mean, there's no such thing that if you've taken Covishield, you cannot ever take Covaxin in your life. There's no such thing. It's unlikely that there'll be any such problem. So please don't hesitate. Just take whatever vaccine is available to you. So with that, Dr. Supraja, any summarizing statement or any particular point that you want everybody to remember?
Yeah. First of all, thank you so much, Sharath, for this excellent session and to learn from each other. So my basic summary would be that children are affected with COVID illness. 90 to 95% of them are mild illness, which can be very well safely and effectively managed at home. We need to have a one-on-one discussion with a pediatrician to pick up the danger signs and to know when a child is deteriorating. We need to have responsible behavior to know that children do not need medications, they do not need investigations, all they need is good monitoring. The best way to prevent the third wave and ourselves and our children from getting COVID is to COVID appropriate behavior and usage of scientific knowledge. If we can adopt this in a responsible way, I'm sure all of us will be safe, smiling, and happy.
Thank you, Dr. Supraja. So that's a very inspiring and positive message. So, Dr. Divya, specifically with respect to the psychological impact of the disease, of the lockdown on parents and on children, how to prevent them, anything that you want to summarize?
Right. Like I already said, having a routine is important. Having a open dialogue, sitting down and talking to children, making them socialize, etc. All that we discussed earlier. Also, a few other things that I would like to add is that sometimes we also fall to fake news. We read something on WhatsApp and we get scared about it. For example, even about the vaccines and things like that. So I think it's important that we inculcate scientific temper in children. As soon, like children also probably read something and they get scared, and because they see their parents very, in angst, they are not discussing, they just keep it to themselves. That might add to their stress. Talk to your child. If they come up with something, go and fact check it. Let that be, something that you do together all the time, so that it inculcates a kind of behavior, responsible behavior, even in your child, that not everything that you read on the internet or on your phone need to be right. Second thing is, do not lie to your child. Don't say things like, you will never get it because I have prayed to God and you will not get it, things like that. Don't say random things. Children are very smart, they will see through it, but they might just play with you and forget, not confront you. Empower them, tell them, you wear a mask, you stay away, you will not get it, right? And also, like I said, this lack of clarity is something very, very stressful for children. So how do we deal with that? Give them hope, show them countries which have opened up, talk to them about vaccines, tell them how smallpox was eradicated, polio is always almost on the way out because of vaccines, how effective the vaccines are. So, and show them how we have already started vaccinating, and other countries who have vaccinated a lot of people, they are coming back to normal. That might take away a lot of that nihilistic, that sad approach all of us are in during the pandemic. So be frank, talk to your child, keep them active, give them adequate, proper nutrition, like Dr. Supraja has told you. Keep them in touch with nature, help them socialize, and adopt COVID appropriate behavior.
So thank you, Dr. Divya. So, and though we've tried to, I think we've managed to answer all the questions. I'm sorry if I have missed out a few questions. I'm sure that I must have missed out a few questions. So if you continue to have questions, of course, you can always reach out to Dr. Divya, who's consulting at both Astra Hospital as well as Optima Arthritis and Rheumatology Clinic, as well as Dr. Supraja, who is a consultant pediatrician and intensivist at Columbia Asia Referral Hospital in Yeshwanthpur. So you can always reach out to them with respect to any other doubts that you might have. So with that, I think I would like to thank Dr. Supraja as well as Dr. Divya again for taking time out from their busy schedule to attend this Facebook Live session. And thank you for being so patient. We have overshot our time by almost half an hour, but still you continue to answer all of our patients' questions and our parents' questions. So thank you so much to both of you. And thank you all for everybody who attended.
Thank you so much.
Thanks, Sharath. Thanks, Supraja.